Hi, everyone. Welcome to the first ever Headspring live stream event. This is something new for us that we're trying out because we wanted an opportunity to share this as widely as we could. So hopefully all of the technology works well for us, and I hope you'll give us some grace and room, permission maybe to be a little messy on our first ever foray into live streaming events. My name is Glenn Burnside. I have the pleasure of serving as the head of operations and strategy here at Headspring, and I could not be more excited to be able to share this with all of you today. This is something that we've been working on for a little while now internally, and realized we had a really unique opportunity to share some of what we've learned through this journey of finding objective data around the coronavirus to be able to make decisions for our own business, and hopefully something that you'll also be able to use with your own business or for your own personal information to be able to understand more about what's really happening across our country. So what we wanted to do was introduce this COVID-19 data analyzer tool today and share with you how to use it. This is something we're making completely freely available on our website at headspring.com/insights/COVID-19. And before I dive into it, I wanted to provide just a little bit of background. The reason that we built our own analyzer came down to the fact that although there's a lot of news coverage happening around this global pandemic, and there's a lot of information that's being shared out there around some of these key numbers, we were finding that there were some gaps in actionable data. And the reason I say that, one of the problems we've run into is every state, every county across the country is reporting this data a little bit differently, highlighting different metrics or different numbers. So if you look at Williamson County or Travis County in Texas versus the Texas state as a whole, or if you compare that to what California is reporting, they may not always be reporting the same numbers. Or even if they are, they might be reporting them in different ways. So a lot of the data sources we were finding were showing historical trends of total cumulative case counts, for instance, which is a really interesting number. But the problem with any sort of cumulative number like that is it never goes down. It only ever can go up as we count new cases. So it can be really hard to look at a chart like that or a number like that and be able to answer the question that everybody really is trying to get to, which is it getting better or is it getting worse? And if it is getting worse, is it getting worse faster than before? Or is it slowing down? And that can be really hard to gauge from those sort of numbers. On the flip side of that, we also saw a lot of sources that were reporting daily counts, just new daily counts. And again, that's a valuable and valid data point, but there's a lot of variance from one day to the next. So there's a lot of noise in that signal, and it can be really difficult to look at a chart like that and then figure out, again, are things rising or falling? If it's up one day and down the next, and then back up the next day, and then back down the day after that, are we getting better or are we getting worse? Are we counting, are we trending upwards or are we trending downwards? And then lastly, as we're starting to make decisions about how to safely and responsibly re-engage with our physical office spaces and provide our team members around the country and around the world with information on how to do that, we wanted to make sure that we were really watching and adhering to the guidelines that the government has put out on this. And the federal government has laid out some pretty straightforward set of guidelines for doing a phased re-entry into the economy. And one of the big things they highlight in there as gating factors to indicate whether we should move into the next phase of reentry or not are these 2-week periods of what the guidelines refer to as a downward trajectory of new cases and fatalities. Well, one of the challenges with that guidance, the way it was put out to the public, is it doesn't really specify what a downward trajectory for 2 weeks means. Does that mean the number of new cases has to go down every single day for 2 straight weeks? Does it mean that the average has to be declining? Does it mean that the net new cases on day 14 have to be less than the net new cases on day 1? There's a lot of things it just doesn't take into account. And so we decided first that we needed to put all of this together for our own usage so we could do our own analysis and make reasoned decisions about what a 2-week downward trajectory on these key numbers meant, and be able to share that objectively and consistently with our team members. So that meant the first thing we had to do was find the data. And thankfully, the New York Times is doing a phenomenal job of gathering data from all over the country and bringing it into a common, consistent format. And they're updating that information every single day. And so the analyzer I'm going to show you is built on a live feed connected with twice daily updates to the New York Times national data set. Then we had to establish a consistent model, and I'm going to take you through exactly what that looks like inside of our tooling, but we built a way of consistently analyzing those 2-week periods of time and looking for the higher order trends that came out of that. And then we also needed to common size our key metrics. And this is really important, especially when you're looking across the country. Raw case counts comparison between Vermont and Texas don't really tell you a lot about how things are doing in those 2 states comparatively. So we wanted to develop a way to common size our analysis regardless of the size of the population we were interacting or viewing over. And then we wanted to take all of that and map it, chart it, interpret it, which made it possible for us, for instance, in Texas, to make some very clear decisions last week that we needed to extend our mandatory work from home time for our team members. And I'll show you why we came to that conclusion. And then we wanted to continue to refine and adapt this as we go. So having done all of that, we realized we had something really useful here, and we got really excited about the opportunity to share it with everybody. So I'm going to turn off my web camera now, turn on my screen share, and I'm going to take you through our COVID-19 data analyzer. All right. So we're looking here at the data analyzer embedded on the Headspring website. Again, this is at headspring.com/insights/COVID-19. And what I'm going to do, this is fully live, fully interactive. You can go there and work with it even while I'm doing this here as well. But what I'm going to do, just to make it as easy to see as possible, is I'm going to take this to full screen. Now this is built using Microsoft Power BI. It's running underneath our service instance of it, and it's just being shared out as an embedded, publicly available iframe in our website. And happy to, anyone who wants to reach out, happy to share the actual file behind this report with you, and you can take and do whatever else you might want to do with it on your own. So what I want to highlight here is our approach for how we're reading and interpreting this data, which again is coming from the New York Times data set. The New York Times actually publishes each day that what they're publishing is a history of cumulative counts of cases and fatalities. But we were able to take those cumulative daily numbers and then from there reverse engineer for each day the net new cases and net new fatalities. And that was really the fundamental starting point of everything else that we built out. So across cases and fatalities, for instance, we can see we've had 1.35 million total cases across the United States and unfortunately 80,683 fatalities as a result of that. The next step in our analysis was trying to smooth out those trending lines. And so what we've built all of our analysis around is a moving 2-week daily average of these 2 counts. Now, what does that mean, a moving 2-week daily average? Well, what that means is that for any given day, we're looking at the last 2 weeks and taking the average daily counts of both of these metrics. And what this does is this allows us to smooth out the noise and the variance on a day-to-day on the trend line, because each data point now actually represents the average of 14 consecutive days of activity. So again, nationally right now, we can see the daily new case average is 25,761. The daily 2-week fatality average is 1,763. The last thing we wanted to be able to do in that common sizing effort was to be able to look at what are the changes in those 2-week daily averages relative to the prior 2-week period. And we found this to be the best way of understanding the federal government's guidelines on downward trajectory, meaning are the average cases and average fatalities for the last 2 weeks of time more or less than the 2 weeks that preceded that. So this is actually giving us a fairly certain comparison that ultimately is covering a 4-week period of data. And because we're doing that as a ratio of change, that allows us to common size that number, whether we're looking at Maine or California or South Carolina or Iowa or Texas. It's always going to be based on the trend of percentage change for that population group. So very quickly here, we get that heads up view of these fundamental numbers. Everything else we're looking at is going to be based around different ways of slicing and dicing and segmenting into analysis of those two key metrics of 2-week daily average case summary, 2-week daily average fatality summary, and then the percentage change in growth week over week. So as you can see right now across the nation, in the last 2 weeks, we're seeing a 12% reduction in net new cases on average and a 16% net change in net new fatalities. That's actually encouraging news. That should make us all feel encouraged that we're starting to see some trends that are heading in the right direction. So what we wanted to do next with that information is break it down by state. And so what we're highlighting in the map here is the relative reduction or increase of case count. The more red a state is, the more that indicates that the case count is still increasing and increasing more rapidly. The more green a state is, indicates that they're having significantly more 2-week over 2-week reduction in case counts. So we can get a quick heads up view down here on the map and see that, for instance, Minnesota is still seeing very rapid growth in net new cases and in fatalities. And what we wanted to do here is be able to highlight with a heads up display on the tooltips very quickly, what are those growth numbers? And again, you'll see that they match in our summary cards at the top. But then also, what does that mean for that federal government's reentry criteria? Are we meeting the criteria or not? So we can see right now, for instance, Minnesota is not meeting either of those criteria, unfortunately. Now, by comparison, when we look at Montana, we can see that Montana is seeing 2-week reductions in both case criteria and in fatalities. And so according to at least these two prime criteria in the federal reentry guidelines, you could conclude that they might be ready to move into the next phase of staged reentry. So as I said, across the country, we're seeing an overall decline, but we still see certain states that are exhibiting more upward trajectory than downward. So obviously, living as I do just north of Austin, and with a lot of our team members being in and around the Austin and Houston areas, really interested to understand what's happening in Texas in specific. One thing you'll note as we're interacting with this is that as I highlight these states, the summaries at the top and the charts off to the right are adjusting as well to show us the results for just that state. So looking over here to these two charts on the right, these are our historical trend lines for our primary indicators, case count and fatality count. The solid blue lines in each are charting that sliding 2-week daily average. So you'll see that through that we get a smoothed out, consistent trend line. Again, here in Texas, unfortunately, we're still seeing a 2-week trend of increasing in both net new cases and fatalities. The dotted lines that are a little thinner behind here are the raw daily case counts. So you can see the difference between the amount of variability that's happening on a daily basis and the benefit of seeing the overall trend in that 2-week line. It'd be very hard to interpret these ups and downs on a daily basis. You can kind of generally get a sense that it's going up, but it's a lot more helpful when we smooth that out with the 2-week average. And then lastly, on each of these charts, we're charting a horizontal analysis line across here of the 75th percentile value of those 2-week averages. And what that means is all of the data points above that chart are the 25% largest values, and everything below that line represents the other 75% of the daily 2-week average count. And what this does is this just helps us to see, as we start to see places that are in more and more of a decline in count, that 75th percentile line will move further and further down towards the 0 line. It also helps, especially when we're looking at these sort of upward trend lines, to be able to get a quick visual cue of how much time we're spending above that 75th percent and how much of that is happening in recent days versus in past days. So, as I noted, we're able to do this segmentation for every state in the United States based on this data. And we're also able to take advantage of some of the interactive capabilities of Power BI to segment this down and see specifics of what's happening within each state. What we can also do in this case is we usually want to see things at a little bit more of a granular level. So we're taking advantage of some of the interactive capabilities here to be able to drill in. So I'm going to select here to see counties in Texas. All right. And so now this is going to take me into a slightly more zoomed in view of what's happening county by county inside the state of Texas. Again, you'll note the numbers up here are matching to what we were seeing on the previous page. The overall state trend line is the same, but now we can see inside of Texas, just as you'd expect, there's places that are seeing more growth in cases and fatalities. There's places that are seeing reductions in cases and fatalities. We can also get a quick view and start to see the gaps of counties that are not reporting. So obviously out in West Texas, a little less populated, but also we're a little shy on data out there right now. Now within this chart, we can go ahead and zoom in and let's take a look at what is happening in our headquarters. So we're headquartered in Austin, Texas, here in Travis County. So we can see very quickly here, Travis County is still seeing an increase in cases reported, 16% increase week over week, 2-week period. But on the positive side, we're seeing an average reduction of 25.81%. And again, you can see how much just variance there is in some of these raw daily counts versus being able to smooth that out like we have. And we just really didn't find any other tools out there that were doing this sort of analysis level, which is why we felt like we needed to build one for ourselves. So I'm going to focus in here on Travis County. But if I control click, I can control click and add in all of the surrounding counties, which is useful for us because we have folks who live in all of these surrounding areas. And so I really want to be able to get a better sense of what's happening across the territory where all of our team members in the Austin area live. And in that case, we can see that across the board, we're still seeing some uptick in cases in the greater Austin metropolitan area at 6%, but good news, some reduction in the fatality count. So let's go ahead and zoom out of there. And I'm curious, I haven't looked at this since we updated the numbers for Monday, what's happening in Harris County, some of our team members out there. And let's see where, yes, so there's Galveston County. I know Dane lives in Galveston County, a little on the southeast side. So again, in the greater Houston area, if I control click in several of these surrounding counties, catch our folks up in the north there. All right, so we're seeing some flattening in the case count, which is actually a good thing to see. Visually, we can see that it's staying pretty flat, and again, about 6% week over week case growth still happening. But unfortunately, in the Houston area right now, we're seeing still a significant increase in the 2 week over week change in fatalities. So we were able to use this information looking across the state of Texas and then in the areas where our team members live and work. It was really clear to us that this was not a good time to start a planned reentry and re-engagement with more contact, because we're just seeing too much continued both new case and fatality growth in our state. And so it was, really easy for us to see this happening inside of Texas and realize we needed to make some adjustments to our timelines. We'll go ahead and go back. And I can go back to my main view just by hitting my back button here. Some folks are a little more tabular data oriented. Some folks like to see these things more visually. So just to be aware, if y'all are using this for yourself, on any of our charts or visuals, we can right click it, select show as a table. And now I'm going to be able to get a full summary view state by state of all of the key metrics that we're surfacing on this particular chart. And they're all sortable, so we can see all the ones who are meeting a case rate or not meeting case rates, not meeting fatality change rates, sort those from the high to the low, and get some insight into all of the individual states. If you just maybe are more of an Excel visually oriented person, and again, we can just go back to the report for that. We also added a second page as a really quick summary of that information. So if you were to go to page 2, if you want to get a really quick heads up view of case growth, fatality growth, and whether those two criteria are being jointly met or not, state by state, we've built this quick little summary table here. Again, these are all sortable, so we can look at the 14 states that are currently seeing reductions in both case growth and fatality growth. And we can also see all of the states that are unfortunately still failing to meet either one or both of those reentry criteria. We can also sort through both of these columns to get a sorted view to see that, for instance, Montana's got the largest 2 week over 2 week reduction. Minnesota, as we noted, is still seeing significant case growth, 263% over the last 2 weeks. And just like if we wanted to view this state by state, we wanted to view it county by county, we can use Power BI's drill in and drill through capabilities. So let's drill into Texas. And now inside of Texas, we can look and see every single county that's currently reporting and how they're doing on reentry. And so again, even though there's a lot of hot spots, there are some places with some good news and good indicators. A lot of them out in the west, out in the panhandle, looks like. But if you're living in Childress or Cherokee, you've got some good news there, and maybe you can start feeling better about re-engaging and reconnecting with your community in person. So again, that second page is available if you want to get more of just a quick tabular heads-up view of what's happening across the country. So that is our COVID-19 analyzer in a nutshell. Like I said, this is available on our website. It's completely embedded there. No need to log in, no need to sign in. You don't need a Power BI account in order to use it. It's just something that we had found enough value in our own business in using it to make informed decisions that are affecting not just our company's health, but also the health and lives of our team members all over the country. That we wanted to share it with you, make it available to you. We hope that you'll make use of it to find insights for yourself, for your teams, for your business. And if you have found this to be something valuable, then we would love to hear back from you. We would love to know how you're using it, what you're learning from it, how it's helped you make better, more data-driven decisions to help everybody and their companies stay healthy and well during these unprecedented times. With that, I want to thank everyone for having joined us today on the live stream. Obviously, we are recording this. We'll be putting it up on YouTube. as soon as we're done here. I hope you all have a wonderful afternoon. We look forward to hearing from you soon. And thank you very much.